So COVID obviously had a big impact on our operations. Luckily, right around the time COVID hit, we formed the Lineage Care Group, which brought Schofield Care and Greenfield's Niagara Lutheran together. So the good news is we had a lot of brain power we could utilize at once. When it first hit, there was a lot of uncertainty. We were kind of, bringing our teams together to say, what are we doing for best practices? What are we doing for infection control? We had like a command center at Niagara Lutheran. We got both organizations together, create new policies, procedures. We were able to work on a larger scale for purchasing medical equipment, things like that. That was the start. Obviously, the virus itself caused a large issue in terms of the impact it had on the residents, the families being able to visit, the staff, the testing that we had to do, the mandates with the vaccines, losing staff because of that. The staffing challenges we already had were an issue without the mandate, and those challenges continued after COVID was not a pandemic anymore. But the operations changed quite a bit. It changed how we treated the staff. It certainly changed our expenses. It really opened us up to see what does infectious disease really do and how quickly it can impact a facility. The number of hours that are required administratively now to track things in terms of infection control, reporting to state, reporting to government, that changed, that really increased the cost. The biggest thing is with the cost increases and reimbursement not really changing, we had to find areas to pull that money from somehow, so we did that. And luckily, again, since we formed Lineage, we were able to build some efficiencies that we wouldn't have been otherwise. So we were pretty lucky for that. A lot of the other things that we did, like I said, operationally, one of the things we're looking at here at Schofield is an expansion, and the board started looking at prior to COVID, but with COVID, we looked at having a separate entrance, separate air handling units, really making it an up-to-date unit for if another disease process comes out, and we'll be ready for it as much as I think we can be. That's going to be separate entrance, private rooms, things like that. So we were planning on building new rooms anyways, but it really changed how we're going to do it, and it's going to increase the expense. But we're doing what's right for the community and for the patients that we are going to have.